This is an overview of Amendment 2 on Florida's ballot November 4th, 2014, the use of marijuana for certain medical conditions. I'm Teresa Miller, an unpaid volunteer. If Amendment 2 passes, it will legalize smoked pot as a medicine. Please view my other videos, in particular the history of legalizing pot under the guise as medicine or this century's greatest scam. Every state that has legalized pot as a medicine has quickly begun to legalize full recreational use. Tax revenue, you might think. Not in Florida. Medicine is not taxed. There are already several marijuana or cannabis-based medicines that have been proven to be safe and effective. In addition, Florida's legislators already passed a low-THC oil-based form of marijuana for epilepsy known as Charlotte's Web Bill. You should know that the Realm of Caring Foundation, started by Charlotte's mother, is working with researchers to study this form of medicine further. Orphan studies for Epidiolex are going on throughout our nation. These children are not smoking pot, they're not getting high. This legislative bill also covers the diseases described in this amendment. Basically, there is no need and never has been a need for this amendment. It's about full legalization. Also, the level of THC in marijuana today compared to the 70s is similar to comparing a 5 milligram Percocet to an 80 milligram Oxycontin. The strength is significantly different. The remainder of this presentation is going to review the details or lack of details in Florida's Amendment 2. Before we begin to look at the details of the amendment, I think it's worth noting that this is a constitutional amendment, not a bill, which means it is implemented exactly as prescribed in the procedure outlined by the amendment. You may hear the proponent state, "Oh, the details will be worked out by the health department." Apparently, the details were left out intentionally, thus allowing many loopholes with room for very broad interpretation and liberal access to smoking pot. Now let's look at the details of the amendment. Who qualifies as a patient? In this, you would expect to see details outlining specifically who would qualify. In Florida's amendment, there's no age requirement. Missing from the amendment is also parental consent. Most other states with medical marijuana are much more detailed and specific. Florida has no age requirement. Personal caregivers. Apparently, they could remember to put an age in here. Someone who's 21 years or older. And here's the qualifier. They have to have agreed to assist. They also can only have 5 patients at one time. Basically, a caregiver has no medical training, no background checks are required, no caregiver standards. And a caregiver could also be a patient, although not their own patient, possibly. I ask you, how is this any different than a drug dealer? Quantity restrictions. The amount of marijuana that can be reasonably presumed to be an adequate supply. Have you ever been given a prescription that said, use adequately for months until you feel better? So basically, missing from the amendment is frequency, length of time, strength, or in this case, potency. This looks like enough pot to keep someone high 24/7. What are they going to do with the extra pot? Probably sell it and flood our neighborhoods and streets with even more pot. Oh wait, I mean medicine. In Colorado, on July 4th, they're having a big festival, marijuana-filled piñata. And since they're not allowed to sell it, guess what they're going to do? They're going to give it away. Can you imagine if our Gasparilla Parade, instead of throwing beads, started throwing marijuana candy? Don't think that won't happen. Treatment centers or pot shops. In this part of the regulation, it says they want to ensure the availability. Well, what does that really mean? What that means is there's no limit on the number of pot shops that'll be infiltrating our neighborhoods and no zoning requirements. So basically, you'll probably end up with a pot shop in your backyard. I can tell you California has more pot shops now than they do Starbucks. Is this what we want around our streets? What specifically is a certification? Well, what it's not is a prescription. It's not approved by FDA. Only FDA-approved medications can be prescribed and sold in pharmacies. There are no guidelines or standards of care. These are just a few of the prominent national organizations that do not support legalizing pot as a medicine. I'm sure you recognize most of them. What they support is research and studies so we can have something safe and approved on our markets here. Next, the amendment addresses who is supposed to be helped by this medicine. Well, none of the organizations previously listed on the slide are proponents of using unethical and unresearched methods such as smoked pot as a medicine. Does your high blood pressure medicine state for high blood pressure and any other condition that you think it might help? How about insulin for diabetics or for any other condition you might think it will help you for? I don't think so. This really doesn't sound much like medicine to me. If this amendment were really about the health of patients, there'd be no need to have other conditions added. That sounds like a catch-all for about anything. In other states, people who have headaches, stress, trouble sleeping, hangnails, and minor pain have all been issued health cards. Does this look like a sickly patient? More than 80% of the cardholders in California and Colorado are white male between the ages of 17 and 35 with no history of chronic illness, but a history of alcohol and other drug use. There's also some definition of a transporter and administrator, but it really sounds just like home delivery service, and administrators show people how to use on site. Liability. Added to the amendment is immunity for any civil or criminal liabilities for the patient, caregiver, and physician. Let's say a physician gives a patient a certification for some pot, and the person has a bad interaction or takes too much, because remember, there's no instructions on this medication. Then let's say the patient is out driving and gets in a car accident. No one is held liable for any of the consequences. This sounds more like a scam to me than health care. The reality is, if this passes, anyone, any age, with any condition, from any state with a certification can obtain medical pot in Florida, and the physician has no responsibility. Also, a physician, I forgot to mention, can be a chiropractor or a dentist or a podiatrist, not just a medical. How will this directly impact you, even if you don't smoke pot or take this medicine? Do you ever drive on the highway? Remember the Oxy Express? With the infrastructure from pill mills in Florida, this is the perfect place and state for the very first legalized smoked pot as medicine if this amendment passes. Another thing to consider is, does this look like medicine? Because this is what's out there in California and Colorado. It seems as though many details were left out of this amendment. If it were really about medicine and health care, those details would be in there. Smoked pot is not a medicine. Florida's landscape is going to be literally changed overnight if this amendment passes. Grow sites and pot shops are going to be everywhere. People driving high all over our highways, and an increase in youth usage. Does this sound like health care? This is the biggest lie of the 21st century. Help keep Florida safe and pot-free. Send this information to your family, friends, co-workers, boss, church members, any association you belong to. We can defeat this amendment. Florida's future depends on all of us. Don't be silent. Don't be dope. Smoked pot is not a medicine. It's about full recreational legalization. For more information, see notopot.org. There's articles, brochures, documentation, studies. A lot of information there that you can send to people to help educate them. Together, we can defeat this amendment.